There's no 100% reliable way to differentiate between idiopathic Parkinson's disease and our drug-induced Parkinsonism, especially in older adults. They're at higher risk. Idiopathic Parkinsonism may predispose you to antipsychotic-induced, and you may be uncovering a latent idiopathic Parkinsonism. One question to ask is the temporal relationship. Do you start seeing these symptoms soon after starting or increasing the dose of an antipsychotic? That's going to suggest the antipsychotic is the offender. Bilateral and symmetrical, idiopathic tends to start more unilateral, but it's not 100%. A resting tremor, more likely Parkinson's, but may occur as well. Non-motor symptoms. So I would say the first one and the last one to me are probably most helpful. What happens is non-motor symptoms show up way before the motor symptoms of idiopathic Parkinson's disease. As a matter of fact, do you know what the first symptom that shows up years before motor symptoms? Anyone know? It's constipation. Alpha-synuclein, which is what's being deposited here and killing dopamine neurons, actually starts forming in the GI tract, in ganglia in the GI tract, and affects that first. And then next is often this late onset REM sleep behavior disorder where they become disinhibited and start acting out dreams, things like that. And hyposmia as well, it can affect the olfactory bulb. So when you see those associated things, obviously it's more the disease. You can also do DAT scans, which we'll talk about another day.